Quick story for anyone who prescribes naltrexone, takes kratom, or thinks natural means safe. She took one pill for alcohol cravings, and within an hour, her body went into severe withdrawal. The drug screen was negative, no opioids. The trigger was kratom, a supplement you can buy at a gas station. Kratom is a widely available herbal product that many people use for pain relief or to ease opioid withdrawal symptoms. Because it is often viewed as natural, patients may not mention it unless asked directly. This becomes clinically important when prescribing medications that block opioid receptors, such as naltrexone, because the combination can trigger sudden, severe withdrawal, a clinical case that illustrates the risk. A 34-year-old woman with alcohol use disorder came to the hospital with intense withdrawal-like symptoms that began about 1 hour after she took her first dose of naltrexone, which had been prescribed to reduce alcohol cravings. She developed excessive yawning, anxiety, irritability, fast heart rate, generalized muscle cramps, and marked discomfort. Laboratory testing showed a blood alcohol concentration of 324 milligrams per deciliter, and the toxicology screen was negative. She was treated with benzodiazepines, but her symptoms did not meaningfully improve. A more detailed history uncovered a key detail. She had been taking 12 kratom capsules every day to self-manage chronic pain and symptoms she associated with opioid withdrawal. On examination, she had dilated pupils and brisk reflexes, findings consistent with opioid withdrawal. When clinicians started sublingual buprenorphine and naloxone, her symptoms rapidly improved and resolved. What explains this reaction? Kratom comes from the plant Mitragona speciosa. Its main active alkaloids, mitragynine and 7-hydroxymitragynine, can produce stimulant effects at lower doses and opioid-like effects at higher doses. The opioid-like effects occur largely through activity at mu-opioid receptors. Naltrexone is an opioid receptor antagonist. When a person has opioid receptor activity from kratom and then takes naltrexone, the naltrexone can displace kratom's alkaloids from the receptors. This abrupt blockade can precipitate acute withdrawal that looks very similar to opioid withdrawal, often with dramatic and rapid symptom onset. Why diagnosis is easy to miss. Kratom is not detected on standard toxicology screening panels. If clinicians rely only on the toxicology screen without asking specifically about kratom and other supplements, the trigger for the withdrawal can be missed and treatment may be delayed. Why buprenorphine and naloxone helped? Buprenorphine is a partial agonist at mu-opioid receptors. That partial agonist activity can relieve withdrawal symptoms by restoring some opioid receptor signaling without producing the full effects of a strong opioid agonist. Naloxone is included to deter misuse of the combination product. Practical takeaways for hospital-based clinicians: ask directly about kratom and other non-prescription supplements before prescribing naltrexone. If severe withdrawal begins soon after naltrexone, consider precipitated withdrawal from an opioid-like substance such as kratom, even when the toxicology screen is negative. Look for objective signs of opioid withdrawal, including dilated pupils, increased reflexes, sweating, tremor, and agitation. Consider evidence-based withdrawal treatment, which may include buprenorphine and naloxone when clinically appropriate. Bottom line, kratom has addiction potential and can create opioid-like dependence. Naltrexone can precipitate sudden kratom withdrawal that closely resembles opioid withdrawal. Clinicians who prescribe naltrexone or care for patients with polysubstance use should routinely screen for kratom use and recognize this interaction to prevent avoidable harm and to treat withdrawal effectively. Don't forget to subscribe and like this video. Take care.